your posture is improving. When you're sitting straight, obviously you'll feel that your breast is not as saggy as before.
Today we are talking about a concern many women face, that is saggy breast. It is something that brings a lot of questions and worries and doubts. So to help us understand all this in a better way, we have Dr. Neha Jain with us today. She is a renowned plastic surgeon. She will help us to clear all our doubts about this. So let's get started, ma'am.
Thank you for having me.
So tell me, what are the most common causes of saggy breast?
Okay. So to understand कि saggy breasts क्यों होते हैं, so the medical terminology is breastosis, which means falling of breasts. And to understand why it happens, I think we all need to understand what is the normal structure of breast. So breasts are soft tissues basically, and they're composed of glandular structures as well as fatty components. So gland makes it more firm, and fat adds fullness and softness to the breast. Now the breast is resting on the chest wall, which is mainly composed of bones. There is a ribs and a layer of muscle, which is called as pectoralis muscle. Now in between the muscle and the breast, there is a thin layer called as the breast fascia. उसमें से निकलते हैं, there are thin cord-like structures which pass through the breast tissue and get attached on the skin, which keeps the breast close to the chest wall. Okay. Now, why sagging happens? I think there are three major causes that I can relate to. Most common is pregnancy. So in pregnancy, what happens is that during pregnancy, there is engorgement of the breast. The gland volume is increasing. Post-pregnancy and post-lactation period, when the breast involutes, what happens is the breast tissue again shrinks. But the skin has already stretched and the skin loses its elasticity with time. So this discrepancy between the decrease in the breast volume and the lax skin causes sagging. Well, of course, there's the effect of gravity on it. Same thing happens with weight fluctuations. So when we, with our lifestyle, with our diet, when we tend to gain weight, that happens and there is more fatty component which gets added to the breast. Now when these people lose considerable amount of weight, what happens is that the breast is losing its volume again and the skin has already stretched. So the sagginess is happening mainly because of this discrepancy of breast volume and skin envelope on it. And with the effect of gravity, everything gets pulled downwards. Now the third reason is aging, I would say. With aging, what happens is that the skin loses its elasticity. So we all know that our skin has a very strong support of dermis, which is mainly very rich in collagen and elastic fibers. With aging, the quantity of the collagen and elastin in the skin reduces, because of which our skin gets lax, it gets thin, and gets more wrinkly. So that is the effect of aging on which causes sagginess of breasts.
Okay. So is it something every woman faces at certain stage of their life?
I think having understood all the causes of breast sagging, I think practically every woman at some stage or the other would experience this breast sagging, unless there is someone who has, constantly maintained her weight and has, not gone through the phase of pregnancy. I can't think of any other reason why breast sagging would not develop in them.
So can weight loss or weight gain affects breast sagginess?
Well, both the situations can. So जब हम weight gain करते हैं, what happens is that volume is increasing. Okay, and when the volume increases, the role of gravity comes more. So there is something called as heaviness with sagging. So there are a lot of women who have very heavy breasts, but they tend to sag because the support जो रहता है breast का वो इतना strong नहीं है to withhold all of that weight. So that happens with weight gain. And second is weight loss again. जो मैंने explain किया है कि breast volume shrink होता है but skin इतना shrink नहीं होती है. So that's why sagging happens. With weight gain, weight loss both.
Okay.
But weight loss can actually worsen the sagging of the breasts. That way.
So does breastfeeding and pregnancy also leads to breast sagging?
Yes. So with pregnancy, what happens is that there is engorgement of the breast as under the influence of all the hormones that come in picture. Post-lactational phase, a lot of women experience that the breast volume has shrunken. Okay, and the skin also shrinks to a certain extent, but not as much. So the sudden change of breast volume that happens can lead to sagging. Yes.
So ma'am, how does the aging or menopause affects the same, like sagginess?
So in women, aging and menopause have their independent roles. menopause again is a phase where there is complete regression of all the hormonal influence which is acting on the breast. So with loss of all of that hormonal influence, the breast tends to involute further. ओके एंड जैसे इन्वोल्यूशन होता है मतलब ब्रेस्ट का वॉल्यूम और कम हो रहा है. ओके एंड टू एड टू इट देर इज द इफेक्ट ऑफ एजिंग which because of which the skin support is not as good, the skin is not as elastic, so there is sagginess which develops because of the role of gravity which is so much on it.
Okay, but on the contrary, I have found with many of my other friends who are like, you know, having this perimenopause phase. So they are gaining the weight, and during that menopause phase, they are experiencing heavy breast, and because of that, saggy breast. So
yes, it happens. So many women I have noticed that the glandular volume comes down, but they start putting on weight. So that is mainly fat which is increasing. So when fat increases in the breast, again the breast become more heavy. And since the skin is not able to support this heaviness of the breast, they tend to sag. So that is the effect of gravity which is coming in picture.
Yeah.
And sagging is happening. So skin is losing its elasticity. It's not as firm as it is in a younger person.
Can any exercise help in breast lifting?
I wouldn't say that there is a direct role of exercise in breast lifting. So if we see the structure of breast, it is not, it doesn't have any muscle inside the breast कि हमने वर्कआउट किया और हमने उसको टोन अप कर लिया. But on the contrary, breast is lying or resting on a layer of muscle which is pectoralis. So people who work out, I can only see that the pectoral muscles are getting strong, your posture is improving. When you're sitting straight, obviously you'll feel that your breast is not as saggy as before. I can only see an indirect thing. There is no direct relation.
So maybe with exercise we can help the part of gravity which will be able to hold that breast. It will help.
No. So the cords which are traveling through the breast tissue, they also don't have any muscle in it. It is prone to gravity, it is prone to stretch, and prone to lose its elasticity with all the weight fluctuations that happen in the breast.
So no exercise do you think can help?
I don't think there's any exercise that can improve the sagginess. I'm saying posture improvement can give you an illusion that your sagginess has decreased.
So many women, they try supportive bras. So how does it help in lifting?
There is no scientific evidence that says that wearing a supportive bra can worsen the sagging or can improve the sagging. I think just from a practical point of view, I would say a well-fitting bra or which can support the breasts and can sort of delay the sagginess of breast that to develop. But there is no scientific evidence that it can worsen or help with sagginess of breast.
Okay. So when do you think someone should talk about this concern to doctor or consult doctor?
Whenever you think that it's bothering you, at any age or any stage of life, if you feel that you're affected by it, it's affecting your confidence, it's affecting your the way you feel about yourself. I think it's time to talk and get some guidance about it.
So what are the most available treatment options for saggy breast?
So to decide about the appropriate treatment for saggy breast, जो nipple position होता है उसके हिसाब से हम decide करते हैं कि breast का ptosis कितना है. Okay, if it is a mild ptosis and in addition to that volume भी कम है, तो हम normally suggest करते हैं implant surgery कराने का. So implant surgery से क्या होता है, volume भी add होता है and plus the implant itself takes the breast tissue up. Okay, so that is for mild with low volume. Now as the grade of ptosis increases, जैसे ptosis का grade बढ़ता जा रहा है, उस हिसाब से हमें surgical breast lift के options I recommend them. उससे हम क्या करते हैं, we are not removing any part of the gland, we are rearranging the gland tissues in such a way that the breast is more uplifted, the nipple areola complex is also lifted up and it is more youthful. Okay, more firmer breasts come with that. In addition to this, अगर हमें लगता है कि breast volume कम है, तो हम साथ में उसको breast volume increase करने के लिए we do fat transfer. So we use your own body fat and it is injected into the breast tissue so that volume can also be added.
So, ma'am, you just talked about the surgical option, but I don't think every woman will directly come for that. They have some fear. So, are there any non-surgical options for the saggy breast?
So, non-surgical options have a very limited role. There are options available in the market like thread lift. So, threads basically are sort of lifting up the breast tissue, but the results cannot match with a surgical result. Okay, what a surgery can, there is kind of, upliftment that you can get with surgical breast lift. I don't think it is available with a thread lift. Other options that are available, like injecting fillers and all of that, I think it can improve the quality of the skin and add little bit of volume to the breasts, but again, it cannot correct sagginess.
Yeah.
So for a person who is coming to me with concerns of sagginess of breast, I think after examination, of course, if the sagginess is moderate to severe, then I think surgical breast lift is the best choice to make.
So, ma'am, what are the risks associated with these kind of surgeries?
Our science and technology has evolved and advanced way better now. So it is as good as undergoing any elective procedure. Okay, like you're going for a gallbladder surgery or any procedure that requires a general anesthesia. Now our anesthesia techniques are also safe. Per se, there is no added risk with undergoing this procedure.
So, how commonly do you think nowadays women are opting for these kind of surgeries?
I have seen that people are now becoming more aware. Their social presence has also increased, because of which more and more women are now feeling confident about going ahead, stepping out of their house, getting a consultation and going in for surgeries. Yes.
So, how long does it require? I mean, does it require any stay in the hospital, and what is the post-surgery maintenance of this thing?
So the hospital stay is very standard. If it is not a severe grade of ptosis, if you're doing a simple augmentation, then the hospital stay is barely a day. I mean, I think as it's a daycare surgery, you can take a discharge on the same day or the next day, depending on how faster you recover from the anesthesia. If we are doing a proper formal, surgical lift rearranging, again, I think 1 or 2 days maximum is the hospital stay, not more than that.
So, any post-surgery care for this?
Post-surgery care is standard for all of our patients who undergo breast surgery. They have to, like from the point of view of recovery, I think 3 to 5 days of recovery at home is good enough. Most of my patients are active from day 5 onwards, they're back to work. They have to avoid any form of lifting work, like, not lifting any heavy weight or gymming or exercising. I recommend all of my patients to start with lower body workouts or, walking and cardio exercises as early as possible. But we have to, sort of delay the upper body workouts to say 4 to 6 weeks.
Okay. So can we see the results immediately after the surgery? Or?
Yes, that's the best part. The results are immediately seen. And that's why the people feel so confident, From the point of view of post-op recovery, I think there is little swelling in the initial phases, which slowly, goes away in a period of, say, 3 months or so. But the results are immediate. Okay. So that's the best part.
So, ma'am, what advice would you like to give our audience who are watching this? Just make them comfortable about, going for such kind of surgeries if they have such problems.
So, I would just want to make every woman understand that, it's your body, love yourself. And if there is anything which is, sort of reducing your confidence or making you feel, less about yourself, don't feel like that. Come forth, come for a consultation. We are here to guide you at how this process can be smoothened. I think the most important thing is having more consultations and understanding the entire process beforehand.
Yeah.
Okay, that is what is going to make you feel more comfortable about undergoing all of these procedures.
Yeah. So at least they should come and consult you, make themselves comfortable before going for such kind of procedures.
Absolutely.
Yeah. So thank you so much, ma'am.
Thank you for having me.
Yeah.